Glycine is known to enhance sleep quality, memory, reduce symptoms of OCD, and also help schizophrenia. Glycine is a conditionally essential amino acid and a neurotransmitter. The simplest of all amino acids, glycine plays a role in the synthesis of nucleic acids, glutathione, RNA, and DNA, and creatine. Glycine is synthesized in your body from threonine through threonine dehydrogenase pathway, choline via the formation of sarcosine, and serine through serine hydroxymethyltransferase. Glycine is considered a conditionally essential amino acid because your body can't produce enough of it on its own, so the remainder must be obtained from foods like meat, fish, dairy, legumes, or supplements. Glycine plays a critical role as a neurotransmitter because it controls your intake of food, behavior, and complete body homeostasis. It can be excitatory or inhibitory. This means that it can stimulate your brain and your nervous system as well as quieten it. Supplementing with glycine has been shown to be effective in treating metabolic disorders, inflammatory disease, obesity, cancer, and diabetes. Glycine helps you to fall asleep more quickly, to reduce insomnia, improve sleep quality, and promote deeper and more restful sleep. Glycine has been shown to be effective in those dealing with schizophrenia, obsessive-compulsive disorder, and depression. Patients who have suffered an ischemic stroke, brain ischemia, or cerebral ischemia are given glycine orally to help to limit the damage to the brain within the first 6 hours of the stroke. Glycine is one of the most important amino acids in your body. It helps in the regulation of cardiovascular, cognitive, and metabolic health. It was discovered in 1829 by French chemist Henri Bracont after boiling gelatine with sulfuric acid, and since then it's been manufactured and distributed commercially as a sweetener and a buffering agent for antacids. Glycine is also a sweet and colorless crystal, and it's synthesized in your body from choline, threonine, and serine. As a therapeutic and nootropic supplement, it provides multiple benefits to human health. It's been shown to be effective for improving skin elasticity, and collagen peptide, which is loaded with glycine, helps to suppress sun-induced skin damage and to reduce wrinkles around the eyes. Glycine supplementation helps to reduce the symptoms of schizophrenia. It helps to reduce symptoms of obsessive-compulsive disorder, and low blood levels of glycine have been associated with depression. Numerous studies have also shown that glycine has potential for improving sleep, enhancing memory, and increasing insulin sensitivity. It modulates inhibitory neurotransmitters via glycine receptors throughout the central nervous system, and it potentiates NMDA receptors, which provides an excitatory response, affecting cognition, mood, immune function, and sleep. Glycine boosts the brain health in several ways. Numerous studies have shown that the glycine influences the quality of sleep, reduces insomnia, and promotes a restful sleep. It does this in a couple of ways. It has a particular affinity for the NMDA receptor and the glycine receptor. This results in increased peripheral blood flow and a subsequent drop in your core body temperature. In other words, glycine works to improve the blood flow to your body's extremities, which in turn reduces your core body temperature. This decrease in the body temperature plays an important part of sleep induction, since the onset of sleep is associated with a lower body temperature. This then progresses to a deeper sleep. Researchers demonstrated in an animal study showing how the glycine triggered a drop in the body temperature, and this helped the subjects to fall asleep more quickly and spend more time in an REM sleep. The study also showed that glycine can help you to experience deep, slow wave sleep more quickly. Glycine has also been shown to increase the production of serotonin in the brain. This helps sleep because serotonin aids in the synthesis of the sleep hormone melatonin. Studies also suggest that glycine can help you to quickly get back to regular sleep after a period of disrupted sleep schedule. Glycine has shown promising results in reducing the symptoms of depression, OCD, anxiety, and bipolar disorder. However, its most profound efficacy is seen in the reduction of schizophrenia symptoms. Post-mortem evaluation of the brains of people with schizophrenia have found fewer NMDA receptors compared to those who didn't have the disease. Researchers also found decreased levels of glycine in both the blood and the cerebrospinal fluid of people with schizophrenia. Glycine is known to be an NMDA agonist. It's well tolerated by the patient in both short and long-term treatment. To date, numerous studies have been conducted to evaluate the efficacy of glycine in treating schizophrenia. The first controlled trial used glycine doses of 15 grams per day, and this showed significant improvements during the glycine treatment. In another study, 21 schizophrenic patients were given high doses of glycine in addition to antipsychotic treatment. A significant 34% reduction in negative symptoms was observed during glycine treatment, and the study authors noted the improvement persisted even after the patients stopped supplementing with the glycine. Sleep deprivation, or the inability to get a good night's sleep, is an increasing concern worldwide. Not enough sleep or poor sleep quality can result in memory loss, poor metabolism, irritability, high blood sugar levels, increased risk of heart disease, inability to concentrate, weight gain, high blood pressure, and low sex drive. Glycine as a nootropic supplement helps the body to make serotonin, and this improves sleep and mood, and it influences key receptors in the brain, resulting in better learning and memory. Low glycine levels in the body are linked to depression. Glycine activates the NMDA receptor in the brain, and it restores serotonin levels, which helps to improve sleep and the ability to fall asleep faster. In one study, 15 adult females were given either a placebo or 3 grams of glycine before bed. The study concluded that supplements with glycine showed a significant improvement in reduced fatigue, liveliness, and clear-headedness the next morning. Glycine helps brain cell signaling, and this boosts cognition, memory, and mood. Glycine taken in high doses has proven to be highly effective in reducing symptoms of schizophrenia. It helps with depression and mental fluency associated with the schizophrenia, and it may improve psychotic symptoms also. Evidence also suggests that glycine assists with depression and neurodegenerative diseases such as Alzheimer's and Huntington's. Glycine also showed a protective effect against neurological damage associated with a stroke, and research suggests improvements in memory, recall, and sustained attention in those who are supplementing with glycine as a nootropic. People who take high-quality glycine supplements report better sleep and improved mood during the day. Some users say they feel more balanced and livelier once they start supplementing with the glycine. Glycine is best taken 60 minutes before bed. Most users report a minimum of 7 hours of undisturbed high-quality sleep. Unlike most sleep inducers, glycine doesn't leave you feeling groggy and fatigued in the morning. On the contrary, users wake up feeling rested and ready to tackle the day. Glycine is good for joint health. It aids in cartilage regeneration by enhancing collagen resynthesis. Glycine can also provide relief from night sweats for pre-menopausal and menopausal women. 22 schizophrenic patients who were treatment-resistant took part in a double-blind, placebo-controlled trial. They were administered 0.8 grams per kg per day of glycine, along with their antipsychotic medication. Clinical assessments were performed bi-weekly. The group who was administered the glycine showed a 24 to 46% reduction in the negative symptoms. In another double-blind, placebo-controlled study, 14 medicated patients with chronic schizophrenia were treated with glycine. The results showed a significant improvement in negative symptoms in the group that was given the glycine, but not in the group with the placebo. In a randomized, placebo-controlled trial, 11 healthy adults were given either 3 grams of glycine or placebo 1 hour before bed for 2 days. The results indicated quicker sleep onset followed by long, restful sleep. In 2012, another placebo-controlled study recruited healthy adults who were restricted to 25% less sleep than normal. Study subjects were given either a placebo or 3 grams of glycine before bed. In subjects who were given the glycine, the data showed a significant reduction in fatigue, often related to reduced sleep. Scientists studied the effects of bioglycine, a biologically active form of glycine, in healthy students with a mean age of 20 years, and middle-aged men with a mean age of 58 years. The researchers specifically measured attention, memory, and mood using a double-blind, randomized design. The results indicated that the bioglycine significantly improved episodic memory in both the young and the middle-aged group, and the middle-aged group also showed a significant improvement in the sustained attention task. The recommended dose of glycine is 3 grams per day. Experts recommend a glycine dose of 0.4 grams per kg of body weight twice a day when taking an atypical antipsychotic like Zyprexa and risperidol. Many human trials have safely used glycine doses of 1 gram per day for supporting brain health after a stroke, and up to 50 grams per day for schizophrenia. Most glycine supplements come in 1000 milligram capsules, and the most effective dose is reported to be 3 grams 60 minutes before bed. Glycine supplements are generally considered non-toxic and safe with few side effects in most people. However, supplementing with 9 grams or more of glycine can result in mild gastrointestinal symptoms such as an upset stomach, nausea, loose stools, or vomiting. Slight sedation is also a possible side effect when taking glycine. Don't take glycine if you're on the antipsychotic drug Clozaril or clozapine. Unlike other drugs that are used to treat schizophrenia, the glycine appears to decrease the effectiveness of Clozaril in some people. Don't use glycine if you're suffering from diarrhea, as it can worsen this condition. Due to lack of sufficient research, glycine should be avoided by breastfeeding and pregnant women unless prescribed by a physician. Your body makes some glycine during the day, but you need more glycine than your body can produce on its own, so you must get it from food or a nootropic supplement. Glycine is particularly effective in those dealing with sleep disorders and insomnia. Supplementing with glycine should provide a good night's sleep and have you feeling well rested the next morning. Glycine has been shown to be effective in those dealing with schizophrenia, even while using most regular medications with the disorder. If you're dealing with schizophrenia, check with your doctor before using any supplements. Glycine as a nootropic supplement used at the recommended doses is non-toxic and safe for most people with little or no side effects. 3 grams of glycine seems to be the most effective for most people taken 60 minutes before bed.